Recovery People is a 501c3 nonprofit that promotes peer and family-led recovery from substance use and related mental health challenges. We envision an ecosystem of recovery in every community that's accessible to everyone. Within our network, we engage, educate, and empower consumers, workers, and service providers in order to impact social change. To elevate the voice of lived experience, we host and participate in a number of coalitions centered around governance, guidance, and/or policy development. Our programs are themed around customer access, choice, and protection, peer-to-career workforce development, and recovery service provider incubation. Nearly 10% of US adults have recovered from drugs and alcohol. At least 25% of the US population has a first-degree relative with a substance use disorder. And 1 in 5 Americans know somebody with an opiate use disorder. The recovery community is large, but our voices are often marginalized and not heard. Many individuals and affected family members lack access to the supports and services that we need to start and sustain recovery. That's why Recovery People is committed to empowering the voice of lived experience in policy and program development. As citizens, we encourage the recovery community to register, vote, and contact their legislators, regardless of party. In Texas, we partner with the Association of Substance Abuse Programs and the Texas Association of Addiction Professionals to host ABCs of Advocacy training and Recovery Day at the Capitol. In addition, we conduct community engagement research that looks like policy priority surveys, town halls, focus groups, and community forums. The results of this research is published and helps shape policy. Other strategies we use to promote greater access include developing policy briefs and analysis, educating policymakers through office visits, public testimony, and public comments, serving as subject matter experts, and upon request from legislators, we help develop policy language. We've also served on several federal advisory committees, such as SAMHSA's CSAT National Advisory Council. At the state level, we've served on the Texas Health and Human Services Behavioral Health Advisory Council, as well as state work groups, such as Peer Specialist, All Texas Access, and the Housing Choice for Persons with Intellectual Disabilities, Mental Health, and Substance Use Disorder Work Group. Recovery People also advocates for individuals and affected family members' rights and consumer choice. Historically, much of our work in this area has been done around advocating for disability and fair housing rights. More recently, we've launched a Buyer's Guide to Recovery, a project which we will continue to build upon. And as the fiscal agent of 2 National Alliance for Recovery Residents affiliates, the Texas Recovery Oriented Housing Network, or TRON, and the Oklahoma Alliance for Recovery Residences, OCAR, we're responsible for publishing a directory of certified recovery housing in Texas and in Oklahoma. Other NAR affiliate responsibilities include administering the grievance process for residents and their advocates who have a complaint or concern about a recovery housing provider. In many cases, the lack of recovery support is due to gaps in the recovery workforce. This is especially true in rural and other marginalized communities. As a solution, Recovery People, in collaboration with UT Health, has developed a statewide approach, or a peer-to-career approach, to workforce development. This approach includes centralizing administrative processes across milestones, such as applications, scholarship awards, instructors or class selection, knowledge assessment, satisfaction surveys, and evaluation. It decentralizes skills development, such as training and supervision, direct services, such as field experience hours, and employment by partnering across a network of local organizations. And it mobilizes peers and stakeholders across the state to guide quality improvement and strategic planning through quarterly advisory council meetings. Because knowledge and skills development is a career-long pursuit, Recovery People provides ongoing continuing education opportunities that range from online self-paced courses to virtual trainings via Zoom or GoToMeeting, in-person trainings such as conferences and retreats, and hybrid courses that mix and match the settings listed above based on individual learning objectives. Recovery People is also a leader in curriculum development, including family recovery specialist, peer supervision, recovery house manager, and medication-assisted treatment proficient recovery housing. That's a mouthful. And these are just a few of the curriculums that we've developed. Like small businesses, or like all small businesses, recovery startups struggle. They often need support around best practices and or sustainability, which is why we launched our Recovery Business Incubator program. Most of our incubator clients have been individuals opening new recovery homes and or who need technical assistance, which is a fancy way of saying non-financial resources such as educational materials and or consulting. Recovery People has also developed an online certification platform that helps systematically review recovery residents' use of national best practice standards. We currently support both TRON and OCAR certifications. We've also provided technical assistance to recovery community organizations at various stages of development, from startup to seeking greater sustainability. In Texas, we coordinated an RCO learning collaborative that focused on negotiating value-based insurance contracts. In Ohio, we developed a RCO mentoring program to support greater statewide capacity. The Recovery Incubator also promotes recovery services for youth and in educational settings. We developed a online training on recovery high schools, alternative peer groups, and collegiate recovery programs. And we developed a policy brief that explores opportunities and barriers for recovery high schools. That was a really high level of all what we do. To learn more, check out our website, RecoveryPeople.org. Whether you're an individual or family member in recovery, a part of the recovery workforce, or a service provider, we invite you to become a part of our recovery community network. It's simple and it doesn't cost any money. Go to RecoveryPeople.org and do one of the following. Either sign up for a newsletter and stay updated on upcoming events. You can create a free user account and access online classes, or contact us with ideas and questions.